Hi, I'm Dr. Andy Bozeman, Chief of Surgery at Fairview Park Hospital. We're preparing this video today to tell you about our plans to restart elective surgery here at Fairview. We feel as though it's important to start opening up elective surgeries to take care of our patients, and it's important that we do this in a way that keeps patients safe and makes them feel comfortable. We've created this short video today to introduce you to this process. Come join us. This is the same-day surgery entrance. This entrance is dedicated for surgical patients at Fairview Park Hospital. Everyone else uses the emergency entrance. Patients that are coming in for surgery or preoperative testing a few days before their surgery will come through this entrance. I'll show you what that will look like. This is our screening station. As you come into the hospital, you'll be met by one of our team members here. They'll take your temperature and ask some basic questions about any symptoms that you might have. As physicians and staff members, this is the same process that we do daily. Once you've been screened at the entryway, you will then receive a mask, and this only takes a few minutes. Once you've completed the screening process, then you'll go to preoperative testing. Come with me now and I'll take you there. On your way to the pre-op testing area, you'll pass through this waiting room here. You'll notice that we're taking unprecedented measures to ensure your safety. The seating has been spaced out widely to allow for appropriate social distancing, and all surfaces are being cleaned routinely. It's also important to note that this area of the hospital is separate from other areas of the hospital that could have patients with viral illnesses. This is a separate area that doesn't come in contact with those other areas. So this is the pre-op testing room. You'll come back here a couple days before surgery to have testing done. Note that this area is cleaned extensively, and we focused our efforts on sanitizing this area, all to ensure your safety, to have a good experience here at Fairview Park Hospital. On the day of your surgery, you'll come through the same-day surgery entrance. Once again, you'll go through the screening process and then make your way to the surgical waiting room here. You'll notice here in this area that the seating has been spaced widely to allow for appropriate social distancing. On the day of your surgery, you're allowed 2 well adult visitors that can accompany you for your procedure. The next stop on our journey is pre-op. Come along with me. This is the pre-op area. All areas are being decontaminated and everything is being sterilized, isolated to minimize any contact risk. We have done this throughout the hospital. There's virtually no contact or interaction between elective surgical patients and any other patient that may be in the hospital for a viral illness or any other reason. As part of the preoperative area, this is where you will await your surgery. Our visitation policy for adult patients is that 2 well adults can accompany you to the hospital, and one of those well adults can come back to the preoperative area with you. For our pediatric patients, we allow 2 well adults to come back to this area. Our next stop is in the operating room, so once you're prepared for surgery, you go over to the operating room. Let's go that way now. Once you finish in the preoperative area, you'll be taken back to the operating room for your procedure. Come with me as we go that way so I can show you an operating room and you'll have a better feel for it. We're back in the operating room now. This is where you'll come back for your procedure. Everything in here is cleaned and sanitized after every case. All surfaces are wiped clean, and we've taken extra measures to make sure everything is spotless. At the end of the day, this room and all of the operating rooms are what we call terminally cleaned, and that's an extra effort is given to completely clean all surfaces from top to bottom. It's a very extensive process. Some of the other things that we're doing to minimize any risk for patients that come to surgery are universal masking. You'll see all staff and employees wearing masks and participating in social distancing. All of these precautions are being done so that each area of the hospital that you're in is going to be clean, safe, and spotless. We're here for you. Please contact us at the number referenced on the screen if you have any questions.